National Coalition of 100 Black Women's West Palm Beach chapter, Community Health Education Talks. We would like to take the opportunity with this program to highlight health issues in our community.
And our lead champion for health equity. Welcome, Dr. Lewis.
I grew up without health insurance and knew firsthand what it meant.
Good evening and welcome, Facebook family. Welcome again to our live broadcast. You are now viewing our NCBW's Community Health Talk Zoom education program. I am Charlotte Leonard and I am the co-chair for the NCBW's Health Committee. The National Coalition of 100 Black Women is a all-women volunteer organization that advocates on behalf of women and girls. The issues that we advocate for include health, economic empowerment, leadership, and advocacy. Tonight, we'd like to present to you one of our community resources and professionals to speak on the area of health and one of our focused initiatives that impact our community. I'll turn it over now to my co-chair, Sabrina Cooper, who will introduce our guest for this evening. Sabrina.
Thank you so much, Charlotte. Good evening, Facebook family and friends. Tonight, we will feature Debby Walters, who is the Executive Director for the Diabetes Coalition of Palm Beach County. Debby currently serves as the Executive Director of the Diabetes Coalition of Palm Beach County. Prior to joining the coalition team in 2015, she served as a health and social service consultant in Florida, where she worked with nonprofit and social service organizations to perform in-depth evaluations and assessments of programs and initiatives using the analysis findings to provide recommendation and specific action plans. In addition, Debby assists organizations to actively develop, seek, and secure new or strengthening existing revenue sources. She served as a content expert overseeing the development of the organization's brand and marketing strategies. She also coordinated, developed, and provided project management and oversight of state and regional continuing education programs and other healthcare provider initiatives. Debby was the Executive Director of the Palm Beach County Community Alliance and also served as the Senior Health Policy Analyst for Association of Maternal and Child Health Programs in Washington, D.C., and the Florida Agency for Healthcare Administration in Tallahassee. In both positions, she had leader responsibility for the development, implementation, and evaluation of state and national legislative, policy, and program activities for women, children, and families, including those having disabilities and or chronic illness. Her work also included oversight of programs and analysis relating to healthcare financing, reimbursement, and the impact of patient-centered medical homes within a managed care-free for service delivery system. Facebook family, please welcome our guest speaker tonight, Ms. Debby Walters. Thank you, Debby, for joining us.
Thank you so much. I really appreciate it. And as I put in the chat, this is especially exciting because March is Women's Month. And don't we all rock? And what we all have been through, I think we need to applaud ourselves. We've learned how to be educators, childcare providers, still continuing to work, and just it's been a ride we've all been on, but here we all are, and women are power. And so I really want to thank you so very much for having me. I know tonight we're going to be talking about diabetes. And as Sabrina said, I am the Executive Director of the Palm Beach County Diabetes Coalition. And so I will be talking about some national statistics, also how it really impacts women. And then looking at quote unquote the numbers you should always know, and if you don't know, well, you need to know, and how you can be an advocate for yourself, as well as some of the myths that go around about regarding diabetes, and who it impacts and who it does not. So again, thank you. And I'm going to turn it over to Sabrina. And if you want to ask me the questions, I'll see what I can come up with.
Okay. Thank you so much for giving us the background on you, and as well as some diabetes. So you did talk about women rock, and we just want to talk about women rocking and diabetes for this month here. So can you just tell us what is diabetes and the different categories in diabetes?
Sure. What diabetes is we all have to have insulin to break down the sugar, so that insulin serves as that key for the glucose to go up throughout our body and to give us that energy we need and we continually need. And what happens with diabetes, with type 1, which you will normally hear that children get, but I will tell you, young adults get type 1 diabetes, they are not able to produce any insulin whatsoever. And in type 2 diabetes, which normally you get when you're older, but I also, again, will tell you, we are seeing a large number of children having type 2 diabetes. But this is when your body produces insulin, but your body is still resistant to that insulin. So type 2 is the one that can really, we can turn around, if you will. Type 1, you can successfully manage, and I want to stress, remember, people who have diabetes, women who have diabetes, are women first. Their mothers, their grandmothers, their sisters, their daughters. The fact that they have diabetes is just part of them. It doesn't tell you about who they are as a person, and we really stress this at the coalition. So basically, also what you have too, when you look at type 1 and type 2 diabetes, you also have, which really impacts women, is gestational diabetes. And this happens to up to about 10% of our women who are pregnant. And so this is why when you are pregnant or you're thinking about getting pregnant, it's really, really important that you look at conceptual counseling. And where are you? If you think you need to lose some weight, working with your doctor and your healthcare providers and your healthcare team, they will let you know what you need to do. But looking at gestational diabetes, what that does is your body is going through so much when you're pregnant. Your hormones are all over the place. And so gestational diabetes, again, you're not really able to use that insulin in the way that your body needs it to. So what your healthcare team will do is between 24 and 28 weeks of pregnancy, they will do a glucose test, a long glucose test, where you have to drink that mixture that is just horrific in tasting, but it gives the results that they need. They will find out if you do indeed have gestational diabetes, and then again, come up with a plan for you and the baby. If you have gestational diabetes, it does not mean that your child will have diabetes. It does not mean that you will get diabetes. However, there is a higher risk of women who have gestational diabetes to get type 2 diabetes later in life. And about 5 to 10% will get diabetes soon after the pregnancy, but more often than not, if you do get diabetes, it'll be maybe 10 years down the road. But again, not everyone does. But this is why it is so important for you as a woman to know your body and know what you need to do to be carrying that baby and have the most successful pregnancy you can have. Because not only is gestational diabetes a problem now, we know that preeclampsia, which is high blood pressure, is also a problem with those who are pregnant. And additionally, we're having bigger babies now, so moms who have bigger babies, we also have to look at where are they after the pregnancy and how are we getting them down to the weight that they would like to be and we need them to be. So those really are the types of diabetes, the main types of diabetes. You still have more, but those are the types of diabetes. And if you want me to, I can sort of give you some figures in terms of what we're looking at in terms of number of individuals having diabetes.
Okay, that's fine. You can give us some data on that, please.
Yeah, okay. And again, we're going to put some of this information up on your Facebook page. I tend to talk very quickly, but please, please, please ask questions or clarifications if you need to. This is really striking to me that over 37 million individuals in the United States have diabetes. 37 million. And then out of that, 28.7 million, or almost 29 million, know that they have diabetes. When you're looking at the 37 million, that equates to 11% of individuals in the United States. And then when you look at the 28 million, you're thinking, well, what about that other 5 million? Or I'm sorry, what about that other 10 million that don't know that they have diabetes? And that's the issue. We have people walking around today that don't know that they have diabetes. And so this is why we're going to talk about you really need to know your numbers. And then also what is really striking to me is another 96 million or 23% of our population are pre-diabetic. That means their A1C or their glucose is higher than the average individual who they say is quote unquote normal. Are any of us normal right now? No. But what we know is that 9 out of 10 of those individuals that have been diagnosed as being pre-diabetic do not know it. They do not know that they are pre-diabetic and have the potential of becoming diabetic. So one of the first things you want to do is really educate people on what diabetes is and why they need to know their numbers. And this is even more striking with our senior population, because we know that over 38% of seniors over age 65 are pre-diabetic. And so again, we need to make sure that everyone knows their numbers.
So Debbie, talk to us tonight about knowing your numbers. Tell us what is number. What do we need to know about our numbers?
Well, let me tell you one other thing first is that 15 million women in our country have been diagnosed with diabetes. And so why do we need to know our numbers? Or what are those numbers that we need to know? Everybody thinks if you know your this is a myth. Everyone thinks that if you know your glucose number and it's normal, you're fine. You don't need to know any other number. Within the coalition, we made the decision as a board to provide free diabetes risk assessments, which will look at your risk factors, whether it's family risk factors, whether your BMI is higher than we'd like to see. Do you have high blood pressure? Did you have gestational diabetes when you were pregnant? We look at those risk factors, but then we provide what's called an A1C. And we do this in the community. We do this at churches, we do it at schools, we do it all over Palm Beach County. We do it in rural areas. We really focus in on underserved areas. So what the A1C is, number one, you do not have to fast to get that number. And with glucose, if you do that, you do have to fast to get an accurate number. So what the A1C number is a 3-month average of your blood glucose. And the normal range for the A1C should be basically 4.8 up to 5.7. And that is your normal range, and that's what we like to see. For pre-diabetes, it's 5.8 through 6.4. And I will tell you, when we see someone who is pre-diabetic, we don't say to that may be pre-diabetic. We don't say to them, oh my gosh, you're pre-diabetic. We do not know that for sure, because sometimes women will be on medications or stressors in their life or going through menopause that may impact that number. What we say is you need to get to your healthcare provider to be further evaluated. And in Palm Beach County, if they don't have a healthcare provider, we as a coalition will try to connect them to someone, so that we're not just saying, these are your numbers, but good luck. What we try to do is say, we ask if, as part of the risk assessment, do you have a regular healthcare provider or medical home? And if not, would you be interested in having us reach out to you to find out what your healthcare options would be? So then we go on to diabetes, the numbers, and that basically is 6.5 on up. Normally the highest A1C that you'll see, that I've seen in 5 years, I think is 13. I will tell you, if we see an A1C number higher than 8 and they have diabetes, we immediately get them either to a hospital or a doctor. If they have, and that has happened, especially, it has happened in, whether it's in the Spanish community, in Black community, any community we've seen this all over race, ethnicities. So we really try to connect. Now, we also have had individuals who have never been diagnosed with diabetes. And we again ask this question, have you ever been diagnosed with diabetes? And so, we'll take that into consideration when we're doing the A1C. And we have a young lady, when we were piloting the A1C test, very thin, very healthy. Her risk factors, when we did the risk assessment of her history, or did she have any risk factors, she basically had none. We did an A1C test. Her number was 6.7. That means that was in the diabetes range. Again, we did not say, oh my gosh, you have diabetes, but we helped her connect to a healthcare provider because she did not have healthcare coverage at that time, or a doctor. The only, she did have one risk factor, and had diabetes did run into her family. So, but if we didn't decide as a coalition that we were going to do this, we would not have caught her, because her risk factor was a number 2 out of 10. So it was during our pilot, and that's when we all looked at each other and said, guess what? We are doing A1Cs on every person that comes through our organization, if they will allow us to. So A1Cs are critical to know what's going on with diabetes. But that if you have diabetes, unfortunately, you're more apt to have problems, cardiac problems, if it's not taken care of. Also cholesterol problems and high blood pressure, or blood pressure issues. So we also do what are called lipid panels during the screening. And that will give you what your total cholesterol is, which should always be lower than 200, what your bad cholesterol level is, which is HDL, and your good cholesterol average. So again, we will go over all of this. You get your results in less than 10 minutes. And so we go through everything and then say, this is what we recommend. But the good news in all of this is diabetes can be prevented. Type 2 diabetes can, through diet, through exercise, through reducing stress. If you are pre-diabetic and your doctor has put you on metformin or another medication, please, please, please take the medication. If you are having problems getting your medication, connect with your community. Usually in most communities, they have community health centers and other avenues of getting that medication. Also, please understand, if you do have diabetes and you have to go on insulin, that doesn't mean that's your fault. It is not your fault. That's another myth. Diabetes, if you do have diabetes, it may require, again, remember, the insulin isn't working right. That glucose isn't being spread throughout your body. So the doctor may say, hey, we're going to give you insulin instead of the metformin. That's so the glucose will be spread throughout the body. The insulin will work correctly. It's not because you have been negligent in what you're doing. So if I can stress nothing else, is not to put the burden on you. follow your doctor's information, follow your doctor's advice. It's a whole team approach. And hopefully they bring in your family too, if you have family, you know, so that everybody can understand what diabetes is, because everybody thinks sugar causes diabetes. Sugar does not cause diabetes. Sugar can contribute to diabetes. There's a difference. But again, the one thing I really want to stress again and again is you need to know those numbers. And remember that having diabetes doesn't mean that you're different than everyone else. It's just that you have to make lifestyle decisions that's going to help you have the quality of life that you want to. I mean, look at Tom Hanks, who has type 2 diabetes. Halle Berry has type 2 diabetes. Cedric the Entertainer has type 2 diabetes. Nick Jonas has type 1 diabetes. You know, we have football players, baseball players, that have diabetes. They've learned to manage their diabetes. Now, if you don't manage your diabetes, it can be horrendous health issues. Everything from, you know, going, if it's really severe, to having kidney disease, kidney failure, obviously, like we said, talking about cardiac issues. And unfortunately, it can lead to death. And right now with COVID, what we're saying is, again, you need to know your numbers and really manage your diabetes and work with your health care providers. And frankly, if there's something you don't understand and that healthcare team isn't giving you the information and the knowledge and the strength and the power to do what you need to do, then look maybe at changing healthcare providers. You're in control. They're not. This is your illness. They're there to help you. They can walk alongside you, just like I walk alongside who we work with, but they are not you. They can't walk a mile in your shoes, but let them walk alongside you. And if you find out, hey, they're tripping me up, then look to see if you need to change that provider or do something else. And in the time of COVID, we know that 25% of those who have been hospitalized had diabetes, and they had severe consequences. And we also know, we've discovered about approximately 14% of newly diagnosed individuals with diabetes, because again, it's affected their pancreas. We have learned that some of those individuals, their blood sugars go back to normal, but about 8 to 10% of those, maybe they didn't know they were pre-diabetic, now have diabetes. But now they're on the road to finding out how they can manage their diabetes and have their quality of life be as good as it possibly can be. One other thing I want to say, if it's your birthday, if it's your anniversary, or if there's a celebration, don't think, I can't have cake, I can't do this, I have diabetes. Celebrate who you are. Celebrate what you've accomplished, whether you become a grandmom, or you know, you've run that first marathon, or you're thinking about running that marathon. That's a good accomplishment. Celebrate it. And also look at new ways of celebrating. But don't give up the joy in life, please.
So Debbie, you talked to us a little bit about the myths. You talked to us a little about COVID and diabetes. You talked to us about pre-diabetes. Can you tell us some proven prevention strategies that work?
Yes. Losing weight. Losing weight. Losing weight. Exercise, exercise, exercise. Again, knowing your numbers, bringing those numbers down. Reducing stress. Reduce stress. Stress can have a real impact on diabetes. Social isolation can really impact your numbers. You know, look at ways, whether you're involved in your church or whether you volunteer, you know, look at ways, what's going to make me happy. We have a diabetes self-management program where it's a free program. And this is all throughout the United States. They have diabetes self-management prevention programs where it's a 6 weeks course. It's available in Spanish, English, and Creole, and other languages. And they teach you the proven evidence-based techniques to manage your diabetes. And, you know, they even give you things like a list of 42 strategies, if you will, to manage the diabetes. Everything from when you go out to dinner, when you're on vacation, what are some management strategies, you know, or again, management or prevention strategies, if you will. We really focus in on prevention as well. You know, the other thing is I would really like to stress is when you do exercise, and I'm just as guilty, if you don't like the exercise, you're not going to do it. Try to get involved in some kind of exercise. And I don't mean going to a gym. Maybe you like to walk. Maybe you like to swim. Maybe you like to shop and walk at the same time and maybe go to a mall. But do some kind of exercise, or even if, you know, if you have heavy cans in your pantry, you can use those to build your muscles. If you have like a exercise bike. I know that in a church that I'm on a faith-based educational committee, and one of our churches out in Belglade, they've started a walking community within their own community, but they're also assessing where it's not, why isn't it safe to walk here? What do they need to do? Remember, exercise can also be working in your garden, playing catch or whatever with your kids or your grandkids, swimming, but do an exercise that you like. And I mean, exercise, let's face it, it's not fun sometimes, but if you do something you like, or you have a buddy system, it's a lot easier, because, you know, I'm not doing this alone then. But really, whether you have high blood pressure, whether you have cholesterol, diabetes, or these are the components that work to bring, you know, Mediterranean diet, the DASH diet. You know, there's certain diets, and they can be geared toward what you like, because again, if you're trying to really do the best you can do, and you don't like the food you're eating, you're not going to stick to it. Explore spices, like we're doing a program with spices and growing different like basil and all good kinds of spices that you can put in your food that can substitute for other things. Look at incorporating olive oil into your diet, you know, and just think outside of that box. But again, Sabrina, what I would say to you, it's exercise, it's diet, it's socialization, it's taking your medication if you need to, and also being the champion of your own body and of your life, you know, and what's going on with inside you. Don't be afraid to speak up.
So Debbie, do you have any upcoming events that the Facebook family would like to attend, or if they want some additional information? Is there anything you can give us, like, to help us out, or reach out to you to participate in some of the things?
Please do reach out to me, but I will warn you, if you do, I put you to work, because our organization is all volunteer. Let me just explain. We have 50 different basic organizations that's part of it, from everything from healthcare providers to universities. We bring students to the community. We train our nursing students and pharmacy students how to do A1C tests, you know, and they do our blood pressures a lot. If you want information, you can always reach me. It's at Debby, Debby, at diabetescoalitionpbc.org. We are going to, I know this is March is Diabetes Awareness Month. In October, because we haven't been able to have a Diabetes Awareness Day, we are going to have our first Diabetes Awareness Day out at Riviera Beach. It's going to be at the marina since COVID. And it's going to be October 16th, which will be a lead-in to Diabetes Month. And we would be doing education. In May, we are doing 4 different events throughout Palm Beach County. I go to each and every event if I possibly can. I can send you a list of the events that we do. And if you're in a different county and you want to know more about our coalition, I will tell you we are unique in that we do have a coalition. There are not many coalitions that are up and running, but that sure doesn't mean we couldn't help you get one up and running. This is my baby. Before I had my real career, but now this is my baby. And because I've seen the difference that we've made, I've seen a young woman who basically ended up in ICU because of high A1C, that she had never been diagnosed with diabetes, who is now not even on any kind of medication. She turned it around. You know, we have success stories, and again, we want to work alongside you. We will never tell you what to do. We can only say what we would recommend, and the decision is in your hands, you know, and we hope that we're helping you to make the right decision or understand more what diabetes and its complications can be, but also that many people live with diabetes or who have once been pre-diabetic, who are not diabetic or pre-diabetic now. And I think also with our seniors, what we find with the A1C tests, not only with our seniors, but it comes to mind that they're the ones that really go, woohoo. We use the A1Cs also to show what they're doing, quote unquote, correct, right. You know, you'll hear all of a sudden, oh, my A1C has gone down. I know now what I'm doing the right way, you know. So we use it to not only see what's going on from the very beginning, but if you come back, I can pull the records to see where you were a year ago, to see what's going on. And, you know, and I think there's a lot of myths like we've been talking about out there, but I also think there's a fear of the unknown. And that's why I like to say, and I'm not the first one to say this, but education is knowledge. Knowledge is power. Power is the wisdom to know how to use it. And that's what we're trying to give you all. And I've learned a lot about it since I've been involved. I was lucky enough when I was in my other career to help write Florida's diabetes legislation before the Affordable Care Act came in. So this has been my heart. And, you know, I want people to understand that it is most definitely a treatable disease, but it's not one to ignore.
Okay. Well, Debbie, we would like to say thank you for providing us tonight with such valuable information on diabetes. We really appreciate you taking the time out to share with the Facebook family on the importance of knowing your numbers and knowing what pre-diabetes are and knowing what we can do to prevent diabetes. So again, we want to say thank you for taking the time out, and we really appreciate you. Thank you.
Thank you. Thanks, everybody.
Good night.
Good night.